At this time, we'll have an opportunity for the public to address the board. That includes Zoom, to address the board on any matters related and on any related matters to the commission that is not listed on the agenda. Comments will be limited to no more than 3 minutes. Is there anybody that would like to speak during public comment? You have an item on here, so when we get, I believe, yeah. Wait. Website. Oh, it's actually not an item. So yes, you'd be able to speak right now.
Sylvia Garza. I just want to say thank you to the board for the air conditioning unit that was provided to us. We did install it 3 weeks ago. It is wonderful. The people are happy. I did update the proposal to include a cooling center as a cooling center on Wednesdays only for right now, between the hours of, I think I said 1 to 8, 1 to 7. And the reason is because we have to get volunteers. Okay, if the other days are hot, but if it reaches 104, we will open up the room so that people can come in. We are working on how to get it for the community to know that we will be open. So my understanding that the city has like a way to do it. So that's how we're gonna go about it. Okay? Do you have any questions in regards to this?
Okay, so the intention is that after, and pretty soon we'll be able to open it up on different days besides Wednesday?
Right, as soon as we can determine what days we have volunteers that can be available to be there.
Okay, and
Okay.
it's been open on Wednesdays?
We open on Wednesdays, and that's the night that we do provide the dinner.
Okay,
So that's one of the reasons that we're gonna open it up that night, that day, because we will have volunteers already set up, setting up for the dinners and things
Yeah.
like that. And that way, till 7 o'clock, and by then it should be cool.
Yeah.
We hope.
Ideally. Okay, awesome, thank you. Any other? All right. Do you have a public comment?
Yeah, kind of. So,
Yeah.
Good evening. So last year you guys, oh, sorry, Cesar Luna, with, Summer Babe Ruth. So last year you guys awarded us, some money for an AED and some other equipment. We had, the AED was kind of an issue for us because it was purchased through the fire department. But since Babe Ruth is actually in a city building, anything that goes inside that building basically has to be approved by the city. So we purchased it with the money that you guys gave us. Fire ordered it through their license. Now we're having an issue with putting it in a public building that belongs to the city. For them to be able to warranty it or be able to take control of it, it would have to be, for all the preventive maintenance, the pads, everything that needs to be serviced on that would have to go through Summer Fire. It would still be at Babe Ruth, but I'm here just to figure out how we can go about making it to where it's their responsibility, but
So what we do, what we. I don't think it costs anything, but we just want to be sure that. And after that, it would come back to us and then we get it serviced, and then next year we just do the process over again. It's battery operated.
it's battery operated, so it.
Like every 2 years or so,
But there's a service that is required by the fire department to submit it in, or they got to turn it in to get service annually. Make sure that it's functioning correctly. It has nothing to do with the battery. They do check the battery, but it's the service, the annual service that needs to be done, and it's done through a license.
Yeah, so so the way when the district awards the money for a grant, the items go to the, obviously Babe Ruth. However, if Babe Ruth decides, hey, it's gonna be better served for the community that the fire department does that. Technically, as long as the contract with or the agreement with the Selma Healthcare District doesn't get breached, meaning that the AED doesn't go to serve, like the community of Kingsburg or something, you're fine allowing them to take ownership in that aspect. It's just not transferring something of value that you're gaining off of, let's say, or like you sell it to them or something, or if they take it and use it in other cases, like they take that AED and then they give you one of lesser value or something like that, which I don't think that's gonna happen. As long as that single AED goes, to the fire department here in Selma, and you get it back every single year,
Hmm.
charged and ready with the battery, that's, not out of date. I don't see why that's not, I wouldn't see that there's any legal, reasons for you to not do so. But I mean, I can refer to legal counsel to make sure.
So it would be given.
But it
Yes, ma'am. Correct. It, it goes through an annual, we say preventative maintenance, but it's calibration to make sure that it's applying the appropriate amount of joules or electricity to the people, to the patients that it's being applied to. It's pretty technical. It makes it easier for Babe Ruth to service their equipment to make sure that we're doing the best for what. Correct. And then it'll be stored during baseball season, it would be stored at the field.
Yeah, for the most part, so we have summer and winter ball. So for the majority of the time, it'll be with us. Whenever it needs to be serviced, they'll pick it up, and whenever our field is not being used, they'll have it and they'll be possessing it. That way it's not sitting there. So if we get broken into, it doesn't get stolen. So they'll have it here at the fire department. And then when the season starts again, I'll go pick it up, goes back into the locker, and we have it. But they will be taking responsibility for the services and everything that are required.
Yeah, as long as the use of the device, the things that were paid for from the healthcare district gets used in the manner that was explained in the agreement, I mean, it's still fine.
Okay.
So you're okay
That-
doing that?
Just wanted to make sure before we went forward with this. So thank you.
Is there anybody else that wanted to make a public comment at this time? Okay, we'll move on to potential conflicts of interest. Any board members who have a potential conflict of interest may now identify the item and recuse themselves from discussing and voting on the matter. Anybody? No, okay. Approval of the past minutes. Let's take a look at the minutes from June 2nd.
So I make a motion to approve with the correction of June 2nd instead of June 6th.
Was that on the minutes or the agenda? Okay, so you're making a motion to change the agenda to say.
I'm
that
just
it was-
approving the minutes with the correction of the date as of June 2nd, because June 6th is the wrong date, right?
They weren't presented with June 6th, though, the minutes, right?
Hmm?
The minutes are fine.
Yeah, the minutes are
correcting
fine.
the fact that the agenda-
Yeah, so so I just want to make it clear, you're correcting the agenda, not the minutes, right? Because the minutes are.
I'm
are
just
correct.
correcting the date.
Yeah, the date
Yeah,
on here.
yeah.
Okay. I mean, if there's no opposition to that, we can change that. Is that okay with everybody? Okay, you can write consensus down on that and we can change that on the agenda. Alrighty, is there a motion to approve the minutes?
I make a motion to approve.
Moved by Director Alanis and seconded by Director Avalos.
Have minutes of
Yes.
Yes. Okay. So we'll move on. Motion was passed. So we'll move on to the information items, the treasurer report.
As of today's balance, it's 520,406.61. April's balance of 2025 was 459,164.31. May's balance was 439,221.12 cents. We had a deposit on 5/21 for 114,545 and 28 cents. Check 1617, Debbie Hubble, 1,245. Check 1717, Leon's Computers, 282.01. Check 1718, Leon's Computers, 476.04. June's balance, 551,743.67 Check 1719, Leon's Computers, $4,000. Check 1720, Leon's Computers, $411. Check 1722, Valley View Air for the Christian Cafe Grant, $13,850. Check 1723, County Clerk Voters, $681.20. Check 1724, Tyler Hensley, that's for the swim grant for the city, $990. Check 1725 was our Sederma insurance, and that has not cleared because I have it with me right here. I just needed to change the address, correct the address, send it off tomorrow. 3,589.16. Check 1727 lifeguard swim grant, I'm not sure how to say these. Malachi Chavez, $100. Check 1728 lifeguard swim grant, Annabella Mayorga, $100. Check 1729 lifeguard swim grant, Emily Anos, $200. And then check 1731, City of Selma Swim Grant Equipment was $2,593.55. Check 1732 lifeguard swim grant, Makira Chavez, $100. And then I put all these checks that I've written out for information purposes. Check 1721, Project Surf Camp ESYN grant that cleared 7/14/25, $750. Check 1726 lifeguard swim grant, Camaro Home cleared 7/3, $100. Check 1730 lifeguard swim grant, Nina Valdez cleared 7/8, $300. Check 1733 Project Surf Swim Grant, ESYN, $225, cleared 7/14/25. Check 1734 attorney fees, cleared 7/8/25, $4,998. Check 1735 lifeguard swim grant, Nina Valdez, $120. That cleared on 7/10. Check 1736 lifeguard swim grant, Emily Anos, cleared 7/10, $320. Check 1738 lifeguard swim grant, Annabella Mayorga, cleared 7/14, $200. Check 1740 lifeguard swim grant, Camaron Home, cleared 7/14, $420. Check 1741 Leon's Computers, cleared 7/14 for $715.94. And checks that have not cleared, lifeguard swim grant, Makira Chavez, $420. Check 1739 lifeguard swim grant, Malachi Chavez, $420. Check 1742 Harshwell Company LLP, that's our auditor, for $11,000. And check 1743 attorney fees for $2,720, which I have with me to give to the attorney. And that's it.
Are there any questions? Questions?
Yeah, I do. Just really quick. Excuse me, I'm sorry. Who gets the mail?
I do.
You get the mail? For the treasurer to get the mail, unless I misunderstood. The person that collects the mail and receives the checks cannot be the same person who deposits the checks. We need checks and balances. So somebody, am I right or wrong? About the person cannot collect the monies and be the one that takes it to the bank. One has to collect the money and then somebody else takes it to the bank and enters in the computer. It's a check and balance.
I think if you have
Well, I've been doing this for 14 years. I've been doing all the checks and balances and depositing the checks and I've never had a problem. So
I know.
I understand what
why-
your problem is.
That's why I don't have a problem. I just want to make sure that we're taken care of.
Oh, it's taken care of.
So, that's why I requested the special district to come and audit our records and set up policies and procedures.
Okay, it's taken care of. There's no issues.
Well, I
There's no
want it on record.
withdrawals.
I
There's
want
only
it on record
deposits.
That
and
I'm
checks
requesting a
that get written
policy
out.
and procedure for checks and balances for deposits. I want it in the minutes. Please.
You want to,
You're
yeah,
gonna,
can you?
There should be a
Madam Chair.
policy. We should have a policy for checks and balances with deposits collected and entered into the
you
computer.
get a copy of the bank
Oh,
statements.
Hold on, Letitia.
Thank you.
So what that's a request to add a policy in our policy that, okay, it has to be a little more clear than just checks and balances.
Okay, hold
It
on.
has to be like like you said, you want it, like you said it a little bit
Yeah.
ago. I would like a policy to go in our governing documents that say the person that, how you said, the person
Okay,
that
I
collects
think you
is-
said it perfectly. I would like a policy created that, say it the way you said it was perfect.
It's the first thing you said, the person that picks up
The
the check, the
check.
mail and receives checks, not be the same person that deposits them.
Right.
Mhm.
And it's not to say that anything's happening that shouldn't be happening, but it's to protect the health board.
Okay. I think,
But if we don't go that way and we don't create the policy and procedure, I want it in the minutes that I requested that happen.
okay, yeah. Definitely right that, Board Member Alanis requested a certain policy for sure. And then what I wanted to make sure is like her policy is written out clearly, hey, this is what I want, and this is what I would like to look into. Just if anybody ever, says something like that, I wouldn't want those to get skipped. So, I guess the way to go about that would be, we do have a policy review ad hoc going on right now
It's good.
with myself and Anthony. We were speaking mostly about the direct or what do you call it? The beginning, the intro and all the direction of the board and their, the purpose and all that kind of stuff. But I could add to that task force or ad hoc, however you'd like to say it, that we take into account the opinions of Board Member Alanis.
Thank you.
Okay.
My question,
Yes.
about when she's, when she's not there to pick up the mail, are you gonna have like a second person?
Well, I guess, so let's say the policy goes through hypothetically, and we put that into our governing documents. That would mean that Letitia herself wouldn't be able to pick up
Mhm.
checks from here and then deposit the same check. So we would have to it wouldn't make sense for the treasurer not to be the person depositing the checks, since she's the person that, handles the money. It would make more sense to task somebody to pick up the
Mhm.
checks from here, rather than have her not do it. So, hypothetically speaking, that's how it would go if that policy gets put in. And the other thing I was gonna ask, there's no policy yet, right? Or there's no
Mm-mm.
policy in our deal?
I don't even think we have policies, to be
For,
honest.
yeah, for checks and stuff, I don't think so, but I think it just says in everybody's job description, if I'm saying like, it's a very general, like, the
Mhm.
treasurer is
Mhm.
responsible for,
Put mine on
anything.
response.
Yeah. Okay, so as of right now, it's okay. However, or that the practice of her picking up the checks and picking up the mail still technically is okay and within our policies. However, we will look into that. And speaking of policies, I guess we can bring up, or I can bring up right now. I want to make sure that we have our policies and vision for the board done and proposed to the public the amount of times necessary before our next meeting, so that there's no confusion on the vision of the board, where the board wants to go, and what what proposals come to the next board meeting as well. Because we did this last time go we went above our usual grant limit, which is okay for the board to do. However, it does not look, or it would not look good on us to continue to do that, every single
Absolutely.
meeting, just because. We came up of a consensus of the board that it was a worthy cause to do so that day. However, if that is something the board wishes to continue to do, it would be in the best interest of the board to put it in our policy. So I would like to work with Anthony in the next, month or so to get these things put into our, or, find a better way to do stuff like that, so we're more transparent to the community, and we encourage and not discourage anybody to ask for grants or not. So
Perfect, thank you.
yeah. But yeah.
Any other comments? Otherwise.
I just need to I want to make sure I don't forget to tell Anthony that, hey, this is what we got to consider as well. For now, is there any other discussion on the treasurer's report? Okay. Is there a motion to accept the treasurer's report? No action necessary? That's right. Okay. Apologies. We'll go to the auditor report.
No auditor here.
Yeah, okay. Alrighty. Was that wasn't, they didn't send us anything, right? To present, they were just gonna come in? Okay, so they just didn't show, okay. Noted. Okay. Okay, in the meantime, we'll move on to, item C, Adventist Health Project final report update.
Can you hear me?
Yes.
Yes? Okay, perfect. Hi, Adelie Rosales, Grants Director for Adventist Health, Selma. Thank you for having us here tonight. Before we begin our report update, I just want to thank the board and express our heartfelt gratitude for your generous support and belief in our mission. Your funding didn't just make this initiative possible, but it made it meaningful. Your steadfast commitment to mental health equity is deeply aligned with our values at Adventist Health. And through this initiative, we were able to expand access, raise awareness, and improve outcomes for those most in need right here in our Selma community. We witnessed powerful engagement from community members who received these services, and we were able to lay the groundwork for sustainable ongoing care that will continue to benefit our Selma residents well beyond the life of the grant. If we can go to the next page, please. So this is our final report. This information here is specifically for services that were provided in the clinic, the one-on-one services with each patient. Go to Since the beginning of the grant, so this is for the 1.5 year period, the last 2 years, we have conducted a total of 586 therapy one-on-one sessions with patients here in Selma. If you can go on to the next slide, please. Of those clinic patients, there were 123 unique patients that are receiving services. I'm sorry? From Selma, there's a total of 51 patients that reside in Selma. And if you look at the chart there, there's a breakdown of surrounding communities for patients that are receiving services here in Selma. Since our last report, from quarter 2025 data that we presented previously to quarter 2025, we've seen an increase in 98 patient visits since then. Since the last reporting quarter, that's an additional 26 unique patients that have begun receiving services from our licensed clinical social worker. That's a blessing. Is a 85.7% increase in the last 3 months. And we haven't finished out the year. I'm not sure if it's dying.
Just really quick, in those surrounding cities with those patients, none of those cities help with this program, correct?
No, that is correct. Your grant funding that you provided for the licensed clinical social worker will provide services to any patients that are seeking mental health services, that are being seen in the ER and that are following up in clinic for patient therapy. Next, please. Out of all of our clinic visits, we've made a total of 813 appointments. It would be wonderful if all of the patients attended their visits, but as we know, just with any medical appointment, sometimes there's other priorities that come up and patients are not able to maintain those appointments. But out of the 813 scheduled appointments, 586 visits were kept. We have a no-show rate of 22.9%. When we started this pilot project, we had 32% of patients that would not make their appointments. And over the course of the program, as we can see, our no-show rate has dropped to 22.9%. So that means more patients are maintaining and keeping their appointments with ongoing therapy. A lot of our sessions too, I was looking at the numbers and the average one-on-one therapy session time was 77 minutes. So that means every time a patient is seeing the therapist, they're spending about 77 minutes of therapy time with her. For that reason, as you can understand, there's a limited amount of patients that the provider can see in an 8-hour day, so they can provide that session for them. Next. This position also sees patients in the emergency room. So when she's not in the clinic, she is spending her time in the emergency room. And we've seen a total of 132 patients in the emergency room since the beginning of the program. In 2024, we had 94 visits. Out of those 94 visits, none of those patients were repeat patients. Those were all unique patients. In 2025, this year so far, we've had a total of 38 visits for the first 2 quarters of this year, and 36 were unique patients, meaning 3 patients had repeat visits in the ER. Next.
I have a question with that.
Yes.
On the unique visits, 3 were, 3 were unique? Out of the 38 visits, 3
Well,
were.
if you go back one more, for 2025, 38. There was 36 unique patients this year.
Okay.
Yes.
Well,
37,
okay.
38, so 2. So there was 2 patients that came back that were seen in the emergency room.
So out of the patients that don't come back, do you think that they still need services or they just don't come back?
They're receiving services. So
Or else?
the social worker, when she is seeing patients that present to the emergency room, they'll present in a mental health crisis, right?
Right.
So that can mean they were brought in by law enforcement and put on a 5150 hold. Patients that are coming in with suicidal ideation. There's patients that come in with substance use disorders, homeless individuals. There's people that can be coming in for other things, but they're identified as also having a need to receive mental health services. And so the social worker will meet with those individuals, make an assessment, If they need to be transferred out for a higher level of care,
Right.
she will work with those higher level of care locations to transfer those patients out so they're not waiting days and days and days in the ER. She can lift 5150s if they don't need to be waiting there and she's done the proper assessment, they can be released. And if they need therapy, additional therapy, she offers that to them and she'll schedule them right away. So oftentimes patients are not having to come back because what we were seeing before this program launched is that there were people that kept coming into the ER for the same thing. They would be referred to see a provider, whether it was to start on medication for mental health or to get therapy. And just because of the backlog, not just within Adventist Health, but any facility that offers mental health services for therapy, patients would, by the time they were able to get an appointment, they were just not interested or it already had been too long, and they were repeat patients that were being seen in the ER. And so she's been able to establish, as you can see, the unique patient count that I had mentioned previously. Those are patients that have been receiving services since she started. That's pretty impactful
Yeah, it is.
numbers there to be able to provide those services to patients who would have otherwise not been able to have that here in Selma.
So the patients that don't come to their appointment, are we working closely with MAP?
Can you,
I can't remember what what it stands for, but MAP, we have a MAP over there by, it used to be First Baptist, but it's a program where if the client, say you call them and Rosemary doesn't want to go to her appointment or pick up her meds, you call them and they go to the client and they give the client a ride. They help the client go get the meds. They help with services that you're not able to do. And it really encourages us to get there because they have no excuse not to get there.
we
But I
off-
didn't know if we were working with MAP.
we do work with other resources that are
Okay.
available in the community to Selma. And if there's patients that reside outside of Selma, we'll also work with their community services.
Okay.
We have a care continuity team
Yes.
that was developed a couple of years ago. And we have a special group of case management nurses and navigators that work with the social worker. So they identify other social determinants of health that that individual may need, and they offer them those services, whether it's transportation, maybe some of those patients are suffering from food insecurity,
Right.
homelessness, I think I already mentioned substance abuse, and they also receive services for that as well.
Okay, so you did say that the therapist sometimes is 77 minutes with the client, right? Is that what
Yes.
I understood? Now, are those billable minutes or you can only bill for 60 minutes?
I think it depends on the patient. If they're there for a consultation, their time might be a little bit longer. If they're there for a follow-up, it's shorter. It'll depend on the patient insurance, and a lot of our patients also don't have insurance.
Right.
And so we do offer a discount for those individuals that are not able to, that don't have, that are underinsured or uninsured.
Okay, thank you.
You're welcome. Next.
Sorry.
No, great questions. So what are some of the common interventions that we've seen in these last year and a half? Data shows that most of our patients that we see in the ER that are presenting and that the social worker is intervening with, patients are coming in for suicide, anxiety, depression. What's being provided to them? She provides patient education, crisis resource referrals, a lot of patients that have substance abuse. So she will link them to our substance use navigator who works in the ER. And they follow up with the patients so that they can see a specialist to help them, start helping them withdraw from whatever substance it is that they're facing. And then the therapist will see them for other items like if they have anxiety or stress, depression. For example, And then we're also doing direct therapy referrals and clinic follow-up scheduling. That's all data that she has been maintaining through the course of the last 2 years to identify specifically what patients are being seen for. Again, our LCSW, she services as a bridge. Her position is unique in that she's a bridge from the ER, stabilizing the patient, and then getting them in to be seen in the clinic with her for services. So what have we done with the funding that you've given us? We have serviced a total of 718 patient visits. And since our last reporting period, that's 120 more patients 3 months ago that we have seen. And I have some closing remarks, but I'm going to leave it open in case you guys have any further questions before I conclude.
Questions right now?
Yes.
Your presentation was pretty straightforward and I kind of
Mhm.
saw everything, the numbers looking is pretty cool.
Fabulous.
I'm glad that, it got kickstarted here in Selma and, I'm hoping it continues.
Mhm.
I think one of the biggest, points of the Selma Healthcare District or the board in general is to kickstart programs like that. Unfortunately, we can't, fund them forever, but I'm glad that Adventist is taking on that initiative to continue it. So
Absolutely fabulous.
We are working right now to create a permanent position for the clinical social worker and keep her here in Selma. And we also have an initiative to start the same pilot project in Hanford, in Reedley, and Tulare, because the hospital has seen the positive impact to our patients. So we want to continue that work in other communities as well. And we couldn't have done it without this funding to jumpstart this pilot project.
We just want to thank you. And we're just happy that we're here to help. That's what we're here for.
Thank you. Just a closing statement. I wrote it down because a lot of information to remember, but your support has been more than just financial. It has been a true partnership, and we're deeply grateful for your collaboration, trust, and encouragement throughout this journey. As we look ahead, we view this final report not as an ending, but as a meaningful milestone in our ongoing commitment to mental health in our Selma community. Adventist Health remains dedicated to building lasting systems of care, support, and healing for our community. Thank you again for believing in our work and for standing with those whose voices too often go unheard. Your investment has created a ripple effect that will carry forward for years to come. Thank you so much.
Thank you.
alrighty. We'll be moving on to the Selma Fire Department report on the CPR classes and the Lucas devices.
Good evening, everyone. Daniel Diaz, EMS Supervisor, Selma Fire Department. Here to give you an update on the Lucas devices that you guys purchased for us at the beginning of this year. So far, so good. Everybody that we've cut in contact with in the public that we took it out to the, what festival did we just have last at the park? And we brought it out, we demonstrated it, and the public were super intrigued and super thankful that you guys were able to purchase those machines for us because they know how much of an impact they have on the community. So just some statistics here. Since we've got it from April to July, there's been a total of 6 cardiac arrest calls that the Lucas device responded to. So that's only within the city limits of Selma. Next slide, please. Breaking that down, 2 of those patients were non-viable for resuscitation, unfortunately. One of those patients, resuscitation was attempted on scene with the Lucas device, but efforts were terminated due to the patient's condition not changing. 3 of those patients were transported to AMC Selma with that Lucas device in use. ROSC was achieved, but not sustained on 2 of the 3 patients during that cardiac arrest event, including efforts at AMC Selma ER. So ROSC is return of spontaneous circulation, which is mean that we got pulses back on those patients on 2 of them. One of those patients ended up expiring in the ER. Another one of those patients actually made it to the ICU for a couple days. Their family was able to go see him, say their goodbyes. So not only is it, you know, getting that patient back, but you know, you can't put any kind of price on saying goodbye to a loved one, you
Right.
know?
Absolutely.
So that's kind of beneficial. We're hoping to get some better success stories out of it, but those numbers so far are really good. You go back one more time. One of those patients did not achieve ROSC and ended up expiring in the ER. Next one, please. So with the Lucas device, a change in our local cardiac arrest protocol actually took place simultaneously as we got those Lucas devices. So with those changes, we are now required to do 20 minutes of CPR on scene at somebody's house. So at wherever our call is, we're setting up camp there and we're providing ACLS services on scene for 20 minutes before we can even transport that patient. They did a recent study here in our local EMS agency, and they found that doing those high quality CPR on scene and ACLS interventions on scene have a better rate of getting patients back. So that's why those Lucas devices are so crucial in our treatment, because that thing doesn't get tired, it doesn't stop. So 20 minutes of CPR for myself
a long
and some of the
time.
other guys, you're gonna get tired, you're gonna get hurt, things are gonna happen. But with that device that you guys purchased for us, that's unavoidable. That thing's not gonna get tired, it's not gonna stop, and it's gonna help us get some better success rates.
So even, excuse me, even if you didn't have the Lucas device, you guys still would have to do the 20
Correct.
minute, oh, wow,
Correct.
that's almost impossible.
Yeah, so luckily,
Yeah.
we are all trained in CPR regardless, but with that Lucas device, it really, really
Yeah.
helps. So within that protocol, high quality CPR is required, and the Lucas device meets all those criteria to consider it high quality CPR. Yep.
Yeah.
So,
So then, even with the diet.
yep.
Yeah.
And then now we're getting there. We're waiting 20 minutes on top of that. So it's a long time.
It is
It's a long time, but we're fortunate enough that they did those studies and they seen better success rates. So that's what we want to see, and that's what we want to see with this equipment. And we just want to say thank you. Not only something I didn't include in there, each one of those cardiac arrest calls, we have 4 guys responding to. You create it, and so 6 times what, 24 people you prevented injuries on that, you know, could have happened. But with that device, we're not bending over, we're not doing that CPR for that duration of time manually anymore. So I just want to say thank you for that too as well. Yeah.
So, with the Lucas device,
Yes.
do the ribs still get cracked?
So it's people say ribs get cracked, but it's actually the cartilage that's
Right.
inside your rib cage that's popping.
Okay.
So that cartilage is super, super strong. So when people say you hear ribs crack, it's actually the cartilage popping inside that rib cage. So it does happen. It happens manually. It happens with the
Okay,
Lucas device.
okay.
It's gonna happen no matter what.
Okay.
It's just
Yes. I
it's just
know.
what it is. Yeah.
If you want good compressions, you're gonna get it.
Yeah. It's gonna
Right.
happen, but it's life or death. So
Right.
if it ends up to a broken rib, but we saved his life,
Yeah.
the broken rib will heal.
Absolutely.
Yeah.
Absolutely.
I had a-
Great job.
I got a question
Any-
about the study.
Sure.
So what the study or you're saying the study revealed is that a patient is better off and more likely to get what is it called? Our
Return to spontaneous circulation.
yes,
Yes.
return of spontaneous circulation. If CPR is administered for 20 minutes before they get into an ambulance.
Before, yeah, they're transported. Correct.
Okay.
Correct.
Yeah.
Mm.
Yeah.
So what the study showed is what we used to do is we used to get there, perform CPR, and we used to load and go. But during that
Good.
movement, the time we spent off the patient's chest doing CPR was all over the place, and it wasn't consistent. And now with that 20 minutes on scene, it ensures consistency, and it gets that blood flowing to where it needs to get to. It gets the ACLS medications flowing to where it needs to get to, and they just seen better results with that.
Yeah.
Dropped it like a rock.
Yeah.
Mhm. Thank- mhm.
Yeah. Okay. No, I was just making sure I understood the
Yeah.
whole 20-minute deal, and yeah, that
Yeah.
makes a whole lot of
It's,
sense.
there are some parameters of when we can leave early if the scene is unsafe.
Yeah.
You know, if it's my family member, why are you still here? You guys need to go. But, you know, send them the time to explain, hey, this is why we're doing this, you know. But there are a few things. And then for kids, we don't wait. Kids, we're going right away. So it's just for adult patients that we're required to do that.
I'm just so happy that you guys have that, those devices. I
Sure.
brag about it all the time, everywhere I go.
Mhm.
Yeah.
It's just amazing, and we're just so happy that we were able to purchase those. You guys deserve it and more. You guys deserve that and more.
Thank you,
Thank
we
you so
appreciate it.
much.
The
Any
only,
other questions for me?
The only other question I would have is, so the study, I'm guessing, was done on patients without the Lucas device in use, right?
No, so
Or was
it was actually done with American Ambulance, Fresno Fire Department, and the receiving facility is Fresno Regional, which is
Okay.
our base hospital for this area. Fresno Fire has one of these on each of their fire engines, so
Yeah.
they use it as well. But they also used manual CPR as well. So the studies with both, they did a compare and contrast to see which one would be better. So they ran a study with the device and the study without it. So they tested pretty much everything, but the consistency they've seen was the CPR being done for 20 minutes on scene
On
without
scene.
being interrupted with patient movement and stuff like that. And that's where
Okay.
they've seen the better success rates.
Okay, cool.
All right. Well, thank you guys. Appreciate it for your time.
Good evening, Donovan Fulner, Battalion Chief, City of Selma Fire Department. Just gonna give the mid-year CPR class update. So to date, well, let me back up. We had some funding kind of hiccups, and I don't think we received funding until late March, early April. But since then, we've been on a tear, and I'll wait for the PowerPoint to get pulled up. Actually, I won't. I won't wait for the PowerPoint to get pulled up. It's been actually very tremendous. We implemented a new kind of system. I spoke to you guys about it previously, where we started requiring a $20 deposit, and that has been huge. And so I've watched I lurk in the Facebook, and seems like there's been some questions regarding, are we getting our $20 back? Are we not? When folks have showed up, we obviously handed them their money back and have tried to address those concerns, short of just commenting on Facebook. But we've seen full classes with the exception of one. So last year, historically, we were seeing, the 6 to 7 range on average. And this year, we've done 4 classes. I'm just talking, dude. You can go through them. So we did 1 class in April, I believe. We did 2 classes in May to just kind of get caught back up to our schedule. And the demand has been there. So we've been literally, turning people away, unfortunately. So folks are showing up and saying, hey, I want to get scheduled for this class. And it's literally being filled the next day. So we put it up on Facebook, and literally within 24 hours, we've had 9 people show up with $20, which is really cool. So to date, we've had 4 CPR classes. We've had 1 class where, I believe it was in July. It said we had 6. It was a typo. It was actually 7. We had 1 person show up late. So to date, we've had 34 people, which is really good. We've got 2 scheduled for August, and then I think we're going to take September off just due to some personnel stuff, and then finish the year out with October and November. Obviously, if there's an increase in demand, any given month, we'll slide those classes around to meet the demand, but it's working. So what we've been doing has been working. It's been very successful. As anybody, I don't know if anybody's had, more family members or friends or whoever participate.
Yeah,
Have you?
My parents both went.
Perfect.
That's awesome.
What'd they say? Yeah.
They were just happy that it's here in Selma. They didn't have to drive to Fresno. They were like, it's convenient. It's awesome that we can do that for them. So.
Perfect.
That
Yep.
My
is-
mom has a daycare, so she needed to get renewed anyways. So.
Even
That's good
better.
to hear.
Instruction was okay, I hope? Good. Good. Anybody else? Oh, perfect. Yeah. Perfect.
So they were.
Yep.
They came here,
Perfect.
they in turn.
Good.
So
Yeah.
Right.
Thank you very much. We're
Absolutely.
very proud of it. Thank you. I appreciate it. I've encouraged people to reach out to you guys and when they've, feel like it's been a success or had an impact. Definitely make sure that they know that you guys, what's not possible without the Selma Healthcare District and to reach out to you guys if they know you on an individual basis. But I'm very appreciative to continue to implement this plan and I think it's working
I think so.
very well to the point where I may come back and ask for more instead of 8. Maybe we do one a month and we do 12. I don't know if you're not opposed to that, but like I said, we've the $20 thing has worked out very, very well. So any questions for us? Yeah,
Yeah,
thank you.
thank you so much for everything you guys do. We really
problem.
appreciate it.
Oh.
Another thing with the 8.
Mm-hmm. Yep. That's a beautiful idea. Thank you.
Aren't, that's great, but aren't the coaches required to know the AED? Oh, I thought they changed that.
That's awesome.
Just first aid. Okay, so just first aid. So
Just first aid?
for the coaches, yeah.
Yeah. Yeah.
That day, but I think it was like an hour before.
My gosh, that's so amazing.
We've been very fortunate to have a resource like Caesar. Caesar works for the fire department for the last 20 years and is heavily involved in a variety of sports within the community, specifically Babe Ruth and baseball.
Yeah.
So absolutely, his partnership has been,
Invaluable.
yes, invaluable.
Awesome.
Thank you so much.
Yeah. Any questions regarding CPR?
Yeah,
Future plan?
the class for the students at the Selma High School, is that's taking place too?
We did that last year and they haven't reached out, to be honest with you. And so I if it's your direction, more than happy to do that. And I'm not opposed to that. I would like to do that. We've had such a high demand, just through the public that we've just
Yeah.
kind of been cycling through the adults, to be honest with you.
I mean, I'm not gonna say like either way, like it was just cool to hear that happened the year before, but
I'm
at this point, it's,
I'm a big proponent of it, to be honest with you, and I don't think that the high school would turn us down, to be honest with you. But when I have 9 people that day when it went on Facebook with $20 in their hand,
Mhm.
we've just kind of been making sure we're doing that. So if we're gonna, my plan was to come back in December. I don't know if you meet in November or December this year, but come back and do another presentation, ask for some more money. We've done the 8 classes. The second year we've done the 8 classes. The first year was, I think, a success, but we learned some stuff. And I think this year's been, we fine-tuned what we needed to fine-tune, and it's been successful so far. So I'm hoping if we can keep this trend, I would make the request for 12 classes. And at that point, it would be very easy to do 1 or 2 for the high school. Obviously, keep the bilingual thing going as well, because that's important for this community.
Yeah.
And for us in the program. So
Are you getting, I'm sorry, go ahead.
what are the class size requirements for hands only?
it's
CPR?
9 to 1.
It's still
So
9
it's
to
9 to 1. That's a American Heart Association requirement. So 9 students, 1 instructor. When we talk about classes being big and turning people away, to be a good steward or a good financial steward of your money, I wouldn't mind having 2 instructors come in and teach a class of 18. I don't necessarily think that that's better though. When you keep class sizes small, I think it tends to be a better learning environment personally. But we've been hitting this, there's 9 people and we've got 4 more, for that next day. Well, at that point I'm losing, 5 students that I could have got if I would have held a separate class and advertised separately. You know what I mean? So,
I see your classes are pretty full on Facebook. I
Yeah.
spend 1 minute and the next minute it's like, we're
gone.
full.
Yeah, exactly. So the demand is there. And so, I attribute that to, I encourage everybody to tell your friends, tell your family. Absolutely. The more people I know age has been a big thing. We actually put out a frequently asked questions along with it. I tried to, like I said, I'm from the community, so looking at News Around Selma, I addressed the different concerns. They talked about, what's the age requirement? How much do we get our money back? There was a handful of questions, at least last year. And so when we've advertised this year, we put out, hey, this is our flyer, but here's this little cheat sheet that if you have a question, it hopefully will answer some of those questions for you, like age and what happens to your $20? We don't go to lunch with it.
Are your
I
bilingual
mean, that would be
classes
cool,
full?
but you say that
Your
again?
bilingual classes, do they get full?
Yes, absolutely.
Oh,
Yep.
okay,
Yep.
yes.
So my hope is to, if we can end up doing 12, end up maybe adding, maybe a third or a fourth actually for the bilingual, just
That's
because there's a demand
awesome.
there. And then obviously, in addition to that, that's a class a month, basically. It keeps us kind of in that routine. And I think it'd be easier for the public because I know for them, I spoke to a gal who came in and was like, man, I was at work and I don't ever know when you guys are going to do them. You put the flyer up and boom, they're,
Right.
by the time I get here, they're gone. And so we ended up making some arrangements for her to ensure she got into a class. But if we were doing them on a more consistent basis, as far as, hey, this is an every month.
Right.
And, I don't know if we would go as far as to pick a specific Saturday, but if they knew to be on the lookout for, hey, there's
Yeah.
one a month,
Yeah.
I'm hoping that we could capture everybody that would want the education.
Yeah. For bilingual, you mean Spanish classes or like a
Yes, sir.
Spanish class?
Yeah, yes, that is correct.
What are what are the, or is there anybody in our fire department that speaks Punjabi, number one?
We don't,
No?
unfortunately.
Is there a possibility to get, like, let's say we do it again next year? I'm just thinking ahead.
Do like an interpreter or something, do an
That
interpreter?
or like have a Punjabi class?
You're talking about, Grav. I stand corrected. We have one per diem EMT.
You would have to be trained in,
Yes.
yeah.
Which that's, would he? I mean, it would be an additional cost. Yeah. If we had somebody who was the instructor on file. And then he just translated the material. I don't know how that. I'll look into that.
Okay, yeah, I'm just thinking because we have a pretty large Punjabi population here. It'd be cool to offer a Punjabi class.
I don't
as well.
disagree. He's a fairly new guy. We haven't quite got him on the, he's still in training, so I
No worries.
honestly, he slipped my mind. So, yeah, and he's a Selma native, actually, if I'm
Oh,
not
sweet.
mistaken, so
Awesome.
even better.
Cool. Just wanted to put it out.
Yeah, absolutely. Any other questions? Perfect.
Any other questions? Yes.
The $40. Had an idea?
That's the good question.
Yeah. I have the information,
It's,
The deposit.
they gave a $20 deposit to hold their seat in the class and then, it had 6 on the board, but it was actually 7. We had a class of 7.
What was
So
your
2 people
suggestion?
didn't show up, so we're left with $40
cash.
in petty cash that's kind of just sitting there.
Idea,
I say yes.
I just. before
That's
we
just
spend
me.
it, I was like,
I think that's a great idea.
That fine? I mean, essentially it's their own thing.
Yeah.
Program,
it's
yeah.
like still-
That was my
Yeah,
thing.
we're
I was
not
gonna say,
gonna-
I'm pretty sure that's okay because it's for the program itself. So, yeah, you're okay doing that.
Perfect. All
Thank
right,
you.
thank you so much for your time. I appreciate it.
Thank you. Alrighty. Now we'll be moving on to item E, IT report on updating the Selma Healthcare District website.
Hello, board. This is Joey.
Good.
So I'm gonna bring up the website. So I believe at the last meeting, I was asked if we could add a area for a blog, right, on
Ask
different,
yeah.
yeah, on the different grants that have been given. That's ready to go. It's on the back end. At this point, I need pictures and the actual content for the blog. So one idea I had going forward, any grants that are proposed and that are approved, that if those that receive the grant, that they can also submit or email a picture or two of whatever equipment, and then maybe with some other staff that are going to use said things. So if they could email that,
Okay.
that would also, because without the content, we can't have that blog.
Yeah.
So, but that's ready to go on the back end. Also, the treasurer reports were given to me, and so I'm working on them, and I apologize for how long it's taking, but they're going to be submitted as soon as I can on the website. Are there any other
So
questions?
then just getting you the like photos and just basically the content to put in that blog section,
Yes.
and then it can go live. Yeah. Yeah. Are there parameters in on the blog, like how long it could be, or is it kind of like a, hey, it could be like pretty long if they needed to?
No, it could be anything at this point. We're just barely starting off.
Mhm.
So if they want to give me a testimonial or just, a paragraph, I would say at minimum a paragraph, and then I can put that together and put it on there with the picture.
Okay.
But I think that would be a great place to start, just to keep it short and simple, to keep people updated on where the money goes.
Sweet. So then just photos of the, the deal, and then a paragraph or two on what
Yeah.
how it's impacted the community.
Yeah.
Awesome.
And then we were going to do it this board meeting, but I'm going to have availability to take pictures, new pictures for the board. So just see me, to make arrangements, and we'll put those pictures on the website as well.
Do you have dates available or just call you and schedule something?
It'll be either the first week of August or second,
August what?
the first or second week of August
Okay.
at our office. It'll just be maybe for that week, you can come in at any time and we can take the picture. The first or second week of August.
Okay.
So we'll have like a booth set up, so to speak.
I'll make sure to see my barber before that.
Yeah. Get ready. Any other questions, board? Thank you.
Thank you. Alrighty, moving on to action items. Consideration of issuance of requests for qualifications for administrative services. Everybody received the request, the RFQ. I received an email. Debbie has decided that today will be her last meeting, and she'll be sending me all her stuff. We're gonna figure out a time to get everything from her on Monday. Debbie, I'd like to say thank you for everything you've done for the board up to this point, and I mean, I really appreciate it. You've gotten me on the right track now, and I wish you well in your future endeavors. So this is the request for qualifications that I came up with. Sent it to legal counsel, and he kind of looked over it and made sure it was all good. But this just needs to be basically approved by the board, and then I was gonna ask to see if Ms. Lorraine, if you and then Letitia could work on the actual like RFQ itself. So like on the back, I put in dates on a rough estimate of how long I'd want it, or of how quickly I'd want it to get done. If that seems reasonable for you guys, if you need to change any dates or anything like that, I was gonna ask if you guys can work on this and then bring back the final candidates like as soon as, or as soon as we can.
Who will be selecting the candidates?
The Letitia and Lorraine
And they'll bring the,
bring the final candidates to the board, and then we have to select them at a board meeting.
okay.
Commissioners, you're creating an ad hoc. Call.
Yes.
So where will this go out? Just, it'll be on our website, or we're gonna send it out, or?
I feel like the best place to do it is anywhere that has like job, well, since it's very specific, you know, like it's administrative services for healthcare district. I mean, if there's any places that any of the board members have a, you know, hey, it's pretty good to go here, pretty good to go there. I don't know if a complete, it has to be public for sure. So, I mean,
Thinking about LinkedIn?
yeah, LinkedIn or somewhere rather like that. But we would have to have a Selma Healthcare District LinkedIn page to like put it on. So like if not, it would have to go through like our personal LinkedIn pages, which I don't think that's okay. Or if that, I don't think is that a, oh, links to, yeah, okay. That's a good idea. Okay, so yeah, so the item itself is to approve the RFQ itself. So if there's anything in there that you think doesn't need to be in there, or it's something you'd like to add, that's what we're going over right now. So like the actual substance of the RFQ itself. As for the, you know, dissemination of it or getting it out to the public, I think that's a good idea. We're probably gonna put a link or place it on our website if we could, and then we'll get a link for that specific page of the website so that, you know, we could put out, you know, in our own personal pages, hey, if we're looking for an administrative secretary, if this suits you, go on here. This is our request for qualifications, the date that you need to do it, and then, you know, go about that way. So then that kind of opens up, you know, if we have a link, we can post it wherever we feel fit. So,
Sounds good.
okay.
I'm sorry to see you leave. I think you're great, Debbie, and I just wish you the best
Unless
in
there's
your
anything
future
you wanna change.
endeavors.
Yeah, so we'd have to, or the only motion right now would be to accept the RFQ and substance itself. So
Make a motion.
there's been moved and seconded to accept the RFQ and to issue it to the public. Moved by Director Alanis, seconded by Director Avalos. Yes.
Roll call to accept the RFQ for admin.
Yes.
Yes. And then just note that the RFQ will be handled by ad hoc committee consisting of Director Avalos and Treasurer Gallardo. Review and evaluate submission. Selection notification is most likely going to be an actual date that we're going to have a meeting. So that's would be a special meeting to either announce or not announce. I'm not sure if that has to be a or would that have to be a meeting, or would they be able to conduct it then? Okay. Ready. Sounds good. Are there any questions on this? No? Alrighty. So we'll move on to number 9, board member reports. This is something that I just added in there just in case. I know most boards have like a time for the board members to kind of report on what they've done, or like, let's say we have if we do any like special initiatives such as one Ms. Avalos brought up a couple meetings ago, that, you know, we're able to report back on those kinds of things, or any ad hocs. There might be, you know, information items or action items that ad hocs bring back, but this might be like in between. So like, for instance, the ad hoc for the policy review that me and Anthony, we haven't had time to meet for that one specifically. So, I mean, we basically, this is a time for me to say, hey, plan to meet, pretty soon on this or for this ad hoc. And, just let the public know that that's, what we're doing. For me, that would be like sort of my board report, but is there anybody else that that has any other reports that you'd like to say? Oh, to have a budget for that, right?
What's the budget for?
So it kind of mirrored what the board had done in the past with during COVID when they were giving the meals to seniors and driving them and all that. But it would be us, correct me if I'm wrong, sponsoring either a night or a certain amount for one of the times that they do their meals on Wednesdays. So that we like sponsor that certain day, and or if possible, do a budget of a certain amount of money to donate to or to, I guess, assist their their seniors feeding program there, or at the senior center itself. So they do give meals to the seniors, but what Ms. Avalos was trying to do is do a budget for us to purchase meals from local restaurants to give to the seniors instead of the meals that they're getting there. So it'd be like us sponsoring those type of things.
With that. Their budget's going up. Would be once a quarter, and we would go volunteer. Anybody else that wants to go volunteer? Right now, it's coming up. Open this year is. Third.
But
That's what they have open for this year, and then we would go next year,
So this is once a quarter?
once a quarter.
it would be, food items purchased, whether it be made, and everything would be
Yeah.
purchased here from businesses in Selma or restaurants. The food would be purchased, so it goes back into the
Yeah.
Selma businesses here to feed. Right.
Essentially just a statement that is essentially what it is that the district is order, using local. Better, everything you've essentially said here,
Dollars until.
It runs,
Is it
it
run-
finishes, yes.
then the board adopts it, that becomes a known initiative.
Mhm.
Sponsoring, and
Yes. I had
Um,
something
I
to
just,
report.
I have a kudos to give out to Toro Market. So these people for that market, they went and they gave a whole pallet of melons. Gave a whole pallet to Pastor Joe because he has these children come in, has classes with them. I mean, how to make things, how to do things. His upcoming one is gonna be on food and nutrition, how to, cook for them. This is what he's doing. So this store on their own went and they dropped off all these melons. I mean, it's a whole pallet.
Okay.
Awesome, thank you.
I had something to say. I wanted to congratulate Jordan Fuentes. He is a Selma citizen. He's a boxer here. And he won his last fight at the Save Mart Center last Saturday. Did a great job. 51-second knockout, amazing. It was a great time. Absolutely wonderful kid. So Kudos to him. Congratulations, Jordan. Did a great job.
Awesome. I watched that. That was awesome.
Yes, I have something. I was hoping in the new year, we can start having open discussion on funding for children with eyeglasses, children with dental work, children, they have a camp where children who've lost their parents, and they take these children to the camp and they get therapy and they spend a week there. To try to de-escalate them, to try to help their grieving process. But, you know, with everything that's coming down now, with the big, beautiful bill that's coming, there's going to be a lot of services that are going to be cut that I think the health board should be able to help with these kids and families. But those are the three things that I'm hoping we can have open dialogue on that.
Okay. Is it like a certain nonprofit that works with them already, or?
Well, because I know before they go to school, the kids go to school, they have to have dental work or a dental checkup, I think, right? And then I was thinking that we could work with one of our vendors who have vision services or whatever.
Yeah.
What is it? An optometrist, right? Optometrist. But there's kids that need eye surgery and they can only go to San Francisco for that. And if we have kids here in Selma that need that, we need to start taking care of our kids. I am in the Lions Club. Yeah. 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 Yeah.
Okay. I see what you're talking about.
Yeah, so we need, there's going to be a lot of stuff coming down, and we need to make sure that we take care of our kids and our community and help just any way we can. That's
I think
just,
it'd be cool to see how the Lions Club did theirs, and then maybe piggyback off of that.
Mhm.
Or
Mhm.
potentially collaborate, because they already have it in place and they're on the
Right.
501(c)(3). So, I have, or the other, okay, so I had one more, I guess, thing to potentially look into. Well, I guess two. So the city of Selma, we don't necessarily have a recreation center yet. And I know there's like the city council continuously is like looking, hey, we want this area or this area. But I mean, this is something that like I had been looking into doing since, I was on the Recreation Commission like 6 years ago. And, unfortunately the stuff that we worked on then didn't happen, and it's been like a really long time. So I wanted to see what the possibility, because one of my biggest things for the youth, and ever since I started my, I guess, civic service in the community, it's always been about helping the youth live healthy, prosperous lives. And I do work at the YMCA in Sequoia Lake, and I'm on the I'm a member of the Y Services Club in Clovis and Fresno, which is one of the last ones. I'm the youngest member, which is crazy. And I just wanted to see what or if the healthcare district could sponsor or run some sort of or help run some sort of preventative care like camps, or I don't know, probably this would probably work with the recreation department, so like Liz or her deal, some sort of preventative care deals, showing kids whether it be the nutrition aspect of healthy foods and understanding that what's healthy, what's not type thing, or getting them into walking around, or like it's honestly as simple as that at this point, because a lot of youth unfortunately are just like stuck on video games and stuff. So it's like it's gonna be get to a point where nobody wants to do sports. There's not going to be enough signups for Babe Ruth at some point. I'm sure they've been declining, or either that, or there's a lot of work going into getting signups for stuff like that. So I would want to look for avenues to support the preventative care aspect of healthcare, because if there is preventative care, then there's less healthcare, which is Michael.
Mhm.
Get off computer. Whatever we're gonna have.
Yeah.
So even if it was. That's gonna get more.
How much is it? I'm sorry, how much is it for the registration for the, for,
Everybody wants to see the. Brothers, neighbors come watch. Money in there.
well, right.
Not do that, because I have one team, I have kids that.
So seeing that, with that being said, I'm going to tell you that I will personally, out of my own pocket, sponsor a child for your team. So reach out to me if a child needs a sponsorship, and I will be more than happy to do that.
Caesar, you should also reach out to the nonprofit Sports Youth and have them put a grant in, put a proposal in. Well, they did know, and then they got discouraged, and they should be. They're nonprofits, they can come. They're taxpayers. Taxpayer money.
Another thing that I would like us to move forward and have open discussion is maybe purchasing some life jackets for the kids who go swimming and stuff. I'm a chaplain for the Fresno County Sheriffs, and I had to do the call for the child that lost his life at Shaver Lake because he improperly put his life jacket on. So maybe we can educate our kids on life jackets and proper usage and just something like that. That was like one of the worst calls I've ever had in my life. So that's near and dear to me, is making sure that these kids, if they're gonna go to the lake, maybe they can have a little life jacket or something. That's really important.
Okay. Um,
That's it for me. I'm
yeah,
sorry.
that would
Any
just probably
programs
be
like that
under
in
an initiative.
Department Chief?
Correct.
No, not yet.
Some of it sounds like it's almost.
Yeah.
which Either making fly.
Mhm, mhm.
And then
Okay.
So I think all these, there's a lot of good ideas. It's just.
I mean, I think the $5,000 micro grant goes a long ways for, you don't have to go more than that, and we stay within our bylaws. I mean,
Correct? Kids that we give this to? What, like jackets?
Yeah, I mean.
Okay, so hypothetically, if we said, hey, we would like to run a class that, you know, teaches parents and the kids, you know, about, you know, say it's like a 20-30 minute class in the evening one of these days. And, you know, every kid that goes gets a life jacket or something like that. That would be something you'd be willing to work with us with? Yeah. It's the, yeah, the naval, yeah, or Coast Guard. Mhm. Yeah. Yeah. Okay. I think the specifics like that, we would be able to do it, but I was just making sure, you know, because
Because we would have
Um,
to.
we would
yeah,
have to come up with it.
somebody
Yeah.
to do that.
Yeah. Okay. That sounds really good. I like that because I've been a lifeguard for like a long time. And I have a lot of good days, but there are a few bad ones. So, um, alrighty. If there's no other, uh, you know, board member reports or initiatives you wanted to bring up at this time, are we okay with adjourning? Alrighty. Any opposition to adjourning? We're adjourned at 7:34.